if I start getting nervous, just hold my hand.
Do you get nervous?
And I will maybe cry.
No, don't be nervous. I'll hold your hand.
I'm very honored, by the way. This is
No,
huge.
No, it's just too.
Hi, everyone. Welcome to our Instagram Live.
Yes.
Our special guest. We have Waseem here. He's the founder of Dontosh. He is the expert injector and national trainer, and he's been in the industry for a long time. So I'm very honored to have him here.
Well, thank you.
Welcome, welcome.
Well, thank you, Yalda, for having me and taking time out of your busy day. I know we're all busy this time of year, and I'm honored to be here and be talking to you and educating those out there who are listening. So Yalda is like myself, and we're both big on education and getting patients educated as well as other injectors educated, because knowledge is power.
Yeah, so we're here to answer everyone's questions. We're excited to also announce that at the end of the live, we're going to have 2 giveaways, and they're great giveaways. So we're saying we'll have 20 units of Botox and a syringe of filler for his patients. Oh. And also I will have 20 units of Botox with a syringe of filler for my patients. So whoever's going to be the winner, please feel free to DM us the next day, and we would love to book your appointment and come see us. So let's start it, guys. So what should we cover today?
You know, I wanted to talk about biostimulants, because that's something that's, like, I do something called exozymes in my office, which is a vitamin and a stimulator. Sculptra is a stimulator.
Hyperdiluted radius.
Hyperdiluted radius is a stimulator. Allergan has acquired a company that is a hyaluronic acid and a biostimulator together. So I do think it's up and coming more, and we're going to have topics of that, and who's the right candidate, who's not the right candidate. When I think of biostimulants, I also think of PRF or PRP. And who's the right candidate for that as well is, you know, something that people need to understand. As we age, we're not getting as much growth factor, so we have to think about our aging process, and if we're in our, you know, late 60s, early 70s, we might not have so much stuff in our blood.
Collagen. No, I do agree. I always tell my patients, you know, after age 30, your body stops producing collagen. Therefore, we're not stopping the aging process, but we can do 3 treatments to help you to preserve that collagen and build that collagen. So be stingy and, you know, get a hold on your collagen. Don't get rid of it. And
I'm still shocked that I say this literally every year at any talk I do, that geriatric skin is age 40 and above. So as a geriatric here to tell
not
you
21.
we're not 21.
Okay, we thought we're having a 21-year-old gentleman here, but I'm sorry, guys. Sorry for bringing someone, you know, quite old.
Geriatric.
Yeah, no, yeah. Do we need
so we have to think about that. All that collagen that we would be producing in our 20s starts to disintegrate in our 30s, and we need some help. You know, that's okay.
So what do you do in your practice? Tell us more a little bit about what you...
So we do PRF. I like it a little bit better than PRP. For those PRP lovers, I apologize.
Yeah.
But I do feel like I do get a better result with it. You use PRF?
So I do use PRF, yes. I mean, I know a lot of my patients, they come and ask for PRP at the end of the day.
Right.
But then, you know, we do educate them and we explain a little bit what the difference is. So do you want to go ahead and cover that?
Yeah, so with PRF, it's a slower spin, and we get our fibrin matrix out of it. So it's not just plasma, it's a little fibrin, and you can get plasma from it as well. The fibrin is what our body's inflammatory response does. So that fibroblastic activity is what, if we got a cut, we get fibroblastic activity coming there to help stimulate the healing process. So I do feel like it works a little bit better. A lot of people, including myself, like on my website, will say PRP, but we really have PRF. Reason is because of SEO, right? Because we're all about standardized, you know, optimizing our search engines.
Yeah,
right? So
true.
My thoughts are, and the company who does my SEO, their thoughts are PRP is more widely searched, so that's why it says that. But leave it to the professional when you go meet your injector and what their preferences are. We all have preferences, but I personally like PRF. I feel like I get a better result. I used PRP for years, and it worked well.
And then you switch to PRF, and then no, it's amazing. You do. I feel like you just get a little bit of extra kick from it.
Yes.
It's like that little cherry on top of the cake.
Yeah.
The goal is to stimulate the collagen. I always tell my patients, the goal is to go from A to B, from no collagen to more collagen.
Yes.
How nowadays there's so many ways to boost that collagen. So who are the patient that you rather to start them with some biostimulator before you start injecting them with filler? Because you know how many people comes to you and ask, I want fillers, and that's the one thing that everyone's constantly focusing on.
So if I have those with like scarring, I love PRF for, like scar tissue who are young. And what I mean by young is not geriatric skin like myself, so anyone under the age of like 40. Once we get above 40, we're not producing as much growth factors in our bloodstream, so therefore using it as a filler is not as optimized, and we don't get the same result as we would. Could we use it? Yes, for those especially who don't want to use it and not do filler and they want to use that instead. I love it in the tear trough.
I do too. Oh my God!
Job.
Especially if if the patient's skin is very thin, if the skin is not healthy, you don't want to just go ahead add hyaluronic acid and create just like this big lump around the eye area. Because
let's talk about that.
Let's talk, shall we?
Let's talk about tear troughs.
Yeah.
Yalda, because you said something exactly like I think.
Like.
I reverse so many tear troughs. I don't know if you guys saw a post that I did a while ago. I had used 32 bottles of reversal in a 2-month time period.
And that's the enzyme that breaks down the hyaluronic acid, which is the filler.
And what Yalda said is the true point. If you have skin laxity, you have to strengthen that skin. So even if you are a candidate for for under eye filler, doing PRP first to strengthen that skin or get better turgor to your skin. I can't think of like a layman term for turgor right now, but tightness to your skin is important. So I'll sometimes do PDO threads in there, like small ones.
Absolutely,
PRF,
absolutely.
Radio frequency, like you have Morpheus, I have Vivace, same. Like doing stuff like that to stimulate and tighten that skin is you have to prep the skin before you can get filler on. I
think a healthy skin matters. I always tell my patient, who would get a better result, a 20-year-old or a 75-year-old? Obviously the 20-year-old, because their skin is healthy, they have so much cushion, and the health of skin is matter. I think we all focus on Botox filler, which is amazing. I do that all day long, but at the same time I like to educate my patient to remind you guys that health of your skin is number one thing that we have to focus on. So Waseem, he's really big on that, and I love that about him.
Yes.
I mean, there's so many other things I love about his work, but these are the little things that you guys can do that consider, like, it's just not about adding volume. We have to work on that saggy skin that is hanging around, otherwise it's just gonna retain more water and it's just gonna migrates.
Pardon me, so as you all are continuing, we want to know just a little bit of background about you two. If you could just reintroduce yourselves for the new people that have joined us.
Oh, I figured I'm a celebrity.
You are a celebrity.
Oh, okay.
Just
guys, it took almost 6 months to get a yes from Waseem. It wasn't that easy, but you know what? I don't give up. I'm an Iranian and I don't take yes for an answer. So with that being said, I finally got a yes.
She's
I went to his office and I knock on his door. I'm like,
so this is Yalda, for those who don't know her. She's an injector in the Arlington area. Very knowledgeable. She's actually an educator as well. I'm Waseem Garbia. I'm known as Unfiltered Injector, educator as well, injector.
National trainer, full of knowledge. So I'm honored to have him here. He is absolutely amazing. You came from another state.
I moved here from North Carolina, where I was also an injector. That's where I started my world of injecting.
Yeah. Any other questions you guys have from us? Beside the fact that I'm 21 and Waseem just turned 59, so just kidding.
I wanted to dive more into that, the tear trough, and tell people that what I would like to use as an example is if we have a bad foundation to a home, the home can't stand. So the same thing with tear trough fillers. So injectors out there and people who are thinking about getting it, please listen to your injectors if they're telling you, hey, you're not a candidate right now, but we can get you there. because strengthening that skin, just like we prep before we do a chemical peel, right? I tell patients, continue using your retinol. We want you to peel more, do your scrub, get as much exfoliation as you can.
Get rid of all that dead skin.
And then that peel will be even better.
Absolutely.
So things like that, you got to prep your skin. So you have to prep the skin for fillers sometimes. And this is a very thin area with low fat content, so it kind of ages a little bit earlier than other places.
And the best part, I know you're big on that too, like before correcting the tear trough, your cheekbones, that's the foundation of your face.
That C curve,
absolutely.
The temples, the cheekbones, the retaining ocular ligament is very important too, to get some foundation under that. I call it, well, actually my medical assistant came up with it, but the leg to stand on is that retaining ligament there. So giving that support for those injectors out there is extremely important.
Tell me a little bit more about, since we're focusing on the eye and tear trough, what are your recommendations when it comes to skincare versus medical graded product or cosmetic product? Because you know there's so many patients that they go to Nordstrom and they spend a lot of money on Chanel Slaughter.
I have to shift for this question.
Oh, well, okay, guys.
Because people are going to attack now.
Woohoo, let's do this. We got this.
I'm a nerd. If it is not something that has gone under medical study, medical review, and I can't have a double-blind study to prove it does what it does, I cannot back it up. Meaning, if you got it at Sephora, I don't believe it's going to work. FDA does not clear it. It's not studied. It's not pharmaceutical grade. That Estee Lauder with shea butter for $900 is not going to work.
Smell good, looks good, the bottle is bougie, but no. I always use the example to my patients, like, okay, you go to CVS, you get yourself Tylenol 3, but then you go to your primary care physician and he gives you Tylenol 3. Right. Both are Tylenol, but at the end of the day, of course, Tylenol 3 will have a higher ingredients and stronger. It's the same concept.
Prescriptive versus
absolutely. So cosmetic product, you guys be careful. You know, going to Sephora or Nordstrom, you are going to just pay for the brand and that beautiful bottle and smells good and feel good. Right. But I have a hard time believing that with that lower ingredients, it's going to do anything.
And maybe it does, who knows, but there's no study to prove it. That's what I hang my hat on. So if I tell someone this eye cream is amazing, it's not because I use it, I do, but also because I have a double-blind study with biopsies and white papers to back that up. And I feel like that's important. I mean, that's how we practice medicine. We know that lowering blood pressure by 10 points will reduce stroke by 50%. Those are studied facts. It's all based on medical studies, and that's how I do my practice. I know Yalda's very, very similar to that. She likes things that are factual and medical, and not frou-frou.
Yeah, frou-frou. Yeah.
Yeah.
We don't like that.
Yeah, we want it to work.
We absolutely. So for patients, I get back to eye, and then after eye, some of the patients are asking about one Kybella and Russian lips. So back to the tear trough, you know, it's important to increase the quality of your skin. Retinol eye cream is one thing that I love to offer to my patient. Hydration, anything with hyaluronic acid that gives you that, you know, hydration. So, you want to talk about Russian lips?
You could start, yeah. Go ahead. How do you feel about that?
I'm all about providing a result that it matches my patient's character. If I'm having a 50-year-old professional, you know, attorney, and she's coming to my office and she wants to just have some enhancement, obviously I'm not going to give her Russian lips results. So I always ask questions and get to know my patients.
Yes.
Because someone may want to have a big lips, but in their head, big lips is something subtle, just hydration. So I always make sure who my patients are first. And I'm all about enhancing the beauty. I specifically don't like fake results. I want someone to look amazing. I want to enhance their beauty, but I don't want their friends or their cousin to pinpoint that, oh my God, look at those lips.
Right.
I want you to have everything done and people dying not knowing what you have done and thinking like, oh, did you change your hair color? Did you just like hang out with Waseem? That's why you look so good.
Did you drink more water?
Yeah, so no, I'm not all about Russian lips. I love enhancement. For my patients who are in their 20s, 30s, of course, I love to give you guys like a juicy, you know, sexy, beautiful list. But again, it has to match your character and your
agreed.
facial structure. You know, if you're someone who's so petite and small, I'm not gonna, you know, I can't do that. I can't
Enhancing
do that.
your anatomy, not changing your anatomy, is key. You can add a cupid's bow, you could add a pout, but we're not changing your actual structure or anatomy. Someone did ask a question about how we feel about collagen supplements, and I lost the question, and I apologize, but someone did, I swear. I wanted to address that. I think they are useful in certain aspects. So collagen 1 and 3 is what we produce for our skin. Collagen 2 is what we need for our joints. So bovine collagen, I drink that every day for my joints. It is anti-aging for bone, like bone broth or whatever. 1 and 3, if the molecule is small enough to pass into the bloodstream, if it's small enough. Most capsules are not going to be small enough.
So it doesn't get digested through
It won't go
your GI
through.
tract. So
Right.
that's
the molecule's too large.
And how do we know what percentage of that even gets absorbed for your face?
Right. So that's why I like Skin Aid, because it's studied.
Gotcha.
It's a medically grade studied collagen that has 93% of it actually get absorbed. And because they use marine collagen, so if you're looking for something that's not Skin Aid, tend towards the marine collagen, because if you look at the marine collagen, the carbon chain of it is small enough to actually pass into the bloodstream and get into the lower capillaries, which are what is feeding the blood system of our skin. So if it's small enough to get that far, then yes, I do think collagen is a great addition, because what you do on the inside, if it reflects from the outside, the skin is one large organ, right? And it's an organ
Isn't
that you
it
can
the
see.
largest organ?
It is.
The largest organ is your skin. It's all about that beautiful skin.
Yes, it is the largest organ. And I think that making sure that you're good within as well as out, because your skin's going to show you. So if someone has acne or rosacea, those are inflammatory diseases because something's going on within as well, and it's just showing on the outside. So I do love certain oral collagens, but they are not all created equal.
Do you sell them in your practice?
I do sell Skin Aid because I do love Skin Aid, and there's other good marine collagen ones out there, but that's the one that, because it has studies to back it up, that I stand behind.
I love to know. I learned so much all the way from you. Thank you so much for sharing.
Pardon me, one of the biggest questions right now is Kybella. Can we use, one of the young ladies was asking, can she use Kybella in an area that she's got liposuction? And then the other question attached to that is, can we use Kybella on the body?
Yes and yes.
For sure, why
All
not?
the
Go
time.
for it.
Yeah.
Absolutely. I feel like fat is fat, Kybella's Kybella's.
Right.
Kybella's job is to dissolve the fat. So if it does work on your submental fat, why not on the fat of your body, you know, your abdomen or your
Right.
flanks? So absolutely.
So back in the early 2000s when I first started with this stuff,
Was it 2000?
early 2000s.
Again, I do have a master here next to me, so
We used to use deoxycholic acid, which is the active ingredient in Kybella. It wasn't made as safely as Kybella is, but we used it everywhere. I mean, abdomen. So for years they've been doing that. I use it a lot with liposuction, because sometimes with liposuction people get a little swollen during the procedure and they kind of miss a spot or two. So yeah, to do some fine tuning on that all day long, it's a great product for that.
absolutely.
Yeah.
No, it's one of my
That's a great
number
question.
one treatment in my practice. I do love it. I feel like for patients who are healthy, they have a great skin quality, not necessarily they need to have liposuction. I mean, I do love liposuction. I think it does an amazing job, but especially for your submental fat, for the neck area, if you don't have to have that scar, and if you don't have to go under the knife, why not? You know,
Right.
with 2-3 session of Kybella, you can get such a huge improvement, and I do love it. I mean, I had it done myself. I was always like skinny, but you know, just genetically I had round face, double chin, and I couldn't get rid of it because it was such a stubborn fat. But just 2 sessions, it just made such a huge difference, and I do love
Sure,
it.
that's great.
Yeah,
It is
thank
great.
you,
did a good
thank
job.
you.
You look great.
Oh, thank you.
Quick question, can she do Kybella because she is breastfeeding?
No. So it's never been studied for lactation, so therefore we can't recommend that it's something that we would recommend doing during breastfeeding. Also, your body's going through a lot of hormonal changes
Yeah.
at that time, so it's really not best to do. Prolactin
safe
levels are
than
high.
sorry. What are your thoughts on when can ladies start doing Botox or filler through when they're breastfeeding? Do you believe that they have to be just completely done? I mean, I really want to get your professional opinion because there's a lot of opinions out there, and I know.
So medically, legally, we would say you should not do it during lactation, right? Because there's, again, no studies on it. Looking at the scientific side of it, it is something that goes intramuscular and stays in the muscle. It doesn't actually go systemic.
Yeah.
So I usually
leave it to the patient.
leave it to the patient.
Yeah.
But again, there's no studies for it saying it does not go into the milk.
Agreed. Okay, very good.
Since we were on the subject of fat, can we talk about mesotherapy?
Yes. So Kybella is a type of mesotherapy. So mesotherapy is just small amounts of injection. So that's a word that gets used a little wrong sometimes. I love the word though, and you guys are using it correctly when you're asking about mesotherapy, because now there's meso fillers, right, with micro droplets of fillers that go and hydrate the skin. But what we used to call Kybella back in 2000 was mesotherapy, and that's small amounts of deoxycholic acid being injected in the abdomen, flanks, back, whatever we're doing. So mesotherapy, Kybella is a type of mesotherapy. Mesotherapy is the general umbrella. Kybella is a type of mesotherapy.
Oh, I love it. Yeah, love
Did that help explain it? Was that
Did we answer the question? Someone was asking about pedio thread lift, and then if you do use pedio thread lift in your practice, and what are your thoughts about Bella Hadid or cat eye lift?
Like you said, it depends on the patient. Depends on their facial structure, their career choice. Those are things that we have to take into factor. Don't want a Supreme Court judge with a Bella Hadid brow.
You don't?
I don't.
Oh my goodness, she may have some feelings and hearts too. No, who knows? But I respect that.
Too?
I do use pedio thread lift for whether it's brow lift, mid face, jawline, neck. But I have to make sure I'm picking the right person. Someone who needs a facelift, they do need a facelift.
Yes.
But if someone has a good skin quality and their skin is, if I can get them, some enhancement and lift them, of course, why not? Yeah. I mean, I had it done myself. Right. I feel like I have it done all, and I love it.
I had it done.
Yeah. It's amazing. It's amazing. Not only, give you a quick lift, but over a period of time, it will help to stimulate the collagen. So what's not to love about it? It
is. I love threads. I think if the reason it got a bad rap is everyone's doing it on everybody, and if you're not the right candidate for it, let's talk about the brow lift for a minute. If you have temple depletion or forehead depletion, like lack of volume, like I do, let's use me as an example where I'm losing volume through here in my forehead, I would be someone that you would need to replete that volume first before you put that thread. That thread needs a structure
some support, absolutely.
Be supported on.
Will you be interested, using some voluma or something to provide some volume for your forehead, or will you be a guy that would be interested to do more like Sculptra? If you had to choose
that's a good one. Mm-hmm. I don't know.
Okay.
Maybe Sculptra.
Sculptra, because
I've never thought of putting it in my forehead.
Voluma?
I like Volbella in the
temple or forehead.
The forehead. I do Voluma here, but I like Volbella here because I feel like it's soft and it moves with you.
So consider, you guys, as we get older, we lose collagen, we lose a lot of soft tissue, and that's why one of the reasons when we're younger, the brows are lifted. As we get older, we lose a lot of, even bone. We do lose bone, we lose collagen, so everything starts going downward. So even we can provide some volume back by injecting the forehead, by injecting the temple. So these are the areas that can be injected as well, in addition to the pedio thread to provide that lift and support.
Yes. So combination therapy is always key, right?
Absolutely.
You can't treat it. I always go back to blood pressure because I did cardiology back in the days. But you can't treat hypertension or high blood pressure with just a medication. It's lifestyle, it's diet, it's exercise, right? You have to do everything all together. So it's the same thing with aesthetics. You can't just throw a filler in there and hope for the best, or a thread in there and hope for the best. It's good skincare, good water content, good sleep habits,
Combination.
collagen
all of
stimulation, lasers.
It's a never ending, you just have to maintain it. I tell my patient, it's like, eating healthy, doing push-ups, gain all that muscle, and then stop. Of course, everything goes back to where it used to be.
Correct.
So you just have to maintain that with whatever it takes.
Maintain the push-up.
Oh, absolutely.
The push-up, yes.
Yeah,
Guns.
You see, the guns, my guns. I'm taking my guns very serious these days.
Someone asked a question about they have a curve under their right eye. It kind of looks odd. Is it because they got tear trough filler but not cheek? That is very possible.
It's absolutely.
Yeah,
we don't do tear trough without correcting
cheeks
and temple.
First.
It's a must. It starts from here. I mean, you start from top to the bottom. Yeah.
I was posing for you.
Did I do a good job?
You did a great job.
Oh, perfect.
We have somebody asking, can PDO thread lifts be used for the neck, and when is the turning point that you decide from a PDO thread lift for neck versus a neck lift?
Great question.
Under the knife.
So
Skin
again,
quality.
I look at studies, right? The studies were based on people in their 30s to 40s with the threads. So above 40 was not actually conducted in their study because, again, geriatric skin. So,
It's important.
but everyone, age is nothing but a number. So you have to look at the skin quality. If the quality of the skin isn't there, either A, you would have to do like hyperdural radius or something to stimulate some collagen in there and then thread. But the quality has to be there. If the quality is not there, the thickness, the turgor, you're not going to get a great result. And neck lifts give such a great result.
I worked with a facial cosmetic surgeon for 9 years, and then there were patients that even after facelift and the neck lift, because the quality of their skin wasn't so healthy, you could see that the results were not as great.
Correct.
Because the skin becomes so thin, like a paper, and when it's been stretched, it just looks very bizarre.
Like a wet paper towel.
Yes, that's not a good look.
No.
Whereas as someone who has such a great skin quality, but then they still want that lift, it's, in my humble opinion, is just a totally result, and it would be a better result. Everyone's doing really good, so thank you for all the good questions. I want all the procedure you are talking about. Of course, come see us.
Someone asked more about, could you tell us more about placement of fillers and what works best? So just that depends. You're talking mainly about the marionette. Sometimes with the marionette we need some support in the jawline, sometimes in the marionette itself, sometimes in the chin. Depending on how we decide to address it patient by patient is how we would choose our product line. Great question, just hard to answer. It's really patient dependent.
Absolutely. Someone is asking that as far as Botox for neck, what are your thoughts? I'm a big fan when it comes to platysma band.
Yeah.
Like those line that
Everywhere.
do you have them? Oh yeah. These are called platysma bands. So you can go ahead and relax that muscle by just using some neuromodulator, obviously.
Yes.
Do you do any other?
I do platysma bands. I do within the neckline,
It hurts.
which with some people helps, not all. I do the Nefertiti where we kind of go along the jawline as well. I feel like that works nicely again on some. And then those fine little lines in the face itself, I will do Botox in those. I feel like that actually helps. I know that we're talking about neck, but when I think neck, I think from here down because this structure affects your neck.
And someone was asking about what do you recommend as far as skin tightening. So you want to cover that as far as laser
Radio frequency.
Or okay.
For me, all day long. You ask another person, they might tell you something completely different, like CO2, erbium. I've used them all. I just love radio frequency. I love the science behind it. It makes sense to me. Heating hydrogen ions, which we're full of, because we're full of H2O, right? So therefore, it's like I tell people it's not a permanent. No laser is permanent. It's like putting your jeans in the dryer. And I know most of you are familiar with that. If you want them a little tighter, you throw it in the dryer.
I like that. Thank
Right?
you. I'm going to use that example starting tomorrow.
yeah.
So I'm stealing that.
Steal away.
Coded by Waseem.
So putting your jeans in the dryer makes them a little tighter. That's what our lasers do. But guess what? You're going to throw them in the dryer again. So it's not permanent.
It's not permanent.
But if you look at the starlets, like Jennifer Aniston has admitted doing to radio frequency from head to toe every year. I mean, she said everywhere over her body. because radiofrequency does stimulate collagen, also tighten. Is it permanent? No, no one said it is. It's nothing in aesthetics or in the world is one and done.
No, absolutely. And they're asking if after how many weeks or month can be, if you're getting your filler, can it be done at the same time, or how many weeks they have to wait apart?
So, if you look at the studies that I have Vivace, you have Morpheus. Vivace studies said 1 month after. I think 3 months is safer. Personally,
I do agree. Yeah, you just don't want to get rid of that beautiful filler that you just received. So you want to be mindful of
so
that.
ideally, I like to do my Vivace series first, and then filler, and then a Vivace yearly to maintain, and filler in between there somewhere.
Yeah, exactly. So what other questions? Anyone that did we miss anyone or didn't answer any questions?
One of the questions was, does the PDO thread lift, is it about skin tone because she's African American skin? Does that affect it in any way?
Not at all.
Yeah.
African American skin would actually respond better because there's a thicker dermal layer.
Yeah, I think they do have a better skin quality for sure. What are your thoughts about non-surgical butt enhancement? What are your thoughts? What services do you offer? And if you can share your knowledge when it comes to non-surgical butt enhancement.
So we do Sculptra, we do Radius for non-surgical butt enhancement. Depending on how much enhancing we want, I think patients need to be realistic. So I use it a lot for like the women who've lost volume on the side, and it's almost like the temple depletion, but in the booty, where there's a little side depletion. I feel like it works really well there. I feel like to lift the top of the glute, it does a great job there. I feel like getting a Kardashian booty for someone who is flattened out, that's
surgery.
just surgical.
That is
yeah, that's not gonna.
I do have
That's
patients that they're very healthy, you know, their BMI is very low. So definitely for those, you know, folks, my only recommendation would be non-surgical, because if you don't have enough fat, therefore, you know, you don't have enough fat to be injected to a different area. So for those boys and girls out there, my favorite treatment is like, I do use hyperdiluted Radius, which is, again, it's very similar to Sculptra. It's a biostimulator.
I actually like the Radius better than Sculptra.
Okay, yeah. No, I do. And I have had patients even after first, even second session, they have noticed a huge improvement. It also helps with quality of your skin. So the skin
100%.
becomes much healthier. So again, this is another treatment that, because we're not stopping the aging process, this is going to be a treatment that maybe after a year, after 2 years, you know, everyone's body is different. It will be something that it has to be continued. If you do 2 sessions, it's not a done deal. You have to continue with these treatments, just like your Botox, just like your filler, just like anything else.
I'm gonna do no, I'll start a fight. Well, we're good. Not between you and me, between us and
go ahead.
the world. If I say something, so I'll just keep my mouth.
All right.
Like this. So good.
All right, you guys. How are we doing with time?
Do you do regular microneedling with PRP?
I do. Okay. Do you just do it injectable?
Yeah, I just
you don't
Yeah.
microneedling? No.
I don't. No. Does it? Yeah.
So we're having a moment here.
We're
We're talking back about PRP or PRF. Usually I do like to, especially if it's for the hair growth. Do you do hair?
Oh yeah.
I love it. Isn't that amazing?
Injectable.
It's like
Amazing.
the best.
PRP did not work as well, I'll be honest.
Yeah.
But PRF, since I started using that 3 years ago,
it does
much
wonder,
better
you
result.
guys. Like for guys out there, hello. If you want to have a little bit, you know, fuller hair, better quality, just all you need 3 sessions and then maintenance.
Right.
So back to PRP or PRF. Usually I do both. I do microneedling, and on top of that, I usually inject them. It depends on the area.
Inject it.
Yes, I do inject it.
I love that.
Yeah.
Okay.
Yeah. So I do.
So that's
both.
what I want to talk about a little bit, but I feel like I might upset some people out
Folks there.
I feel as if we microneedle. I don't feel as if I'm just speaking medically. When people bleed out, you can't put something that has a larger molecule back in a hole that's bleeding, right? So if someone's bleeding from a microneedle and then you're putting a thick gelatinous substance as PRF or PRP
On top of it?
on top, do you feel like it would absorb well?
Not much, no.
Not much.
Yeah.
So people come and ask me for that all the time. I tell them I know Kim K did it back in the day. It's just, I would rather you spend your money more wisely, because it is, you went from a like $300 procedure to a $900 procedure for something that's not going to give you $900 of result. That's my personal take. Just because when you're bleeding, it is really hard to get something thick in a small hole that your body's clotting off.
Absolutely. It's impossible. Like it's a
impossible.
common sense in my humble opinion.
Right. Medically. I just don't think like
Yeah.
medically it's possible.
For sure.
We're going to get sued, but that's okay.
Yeah. Are you ready? Okay, so we're going out of business. Coming soon.
Coming soon.
Book your appointment before Waseem and I were like losing
On
our
the street,
license
yeah.
in the street. Exactly.
So we have a topic that kind of relates to the Russian lips, and that's filler migration.
That's a big one.
So as I'm gaining more experience, not near close to his experience, but
No, you're good.
I'm
Yeah.
getting there.
You're getting there.
Getting there,
Yeah.
yeah. Slowly but
Definitely.
surely.
Tomorrow. You'll be done.
You think
Yeah,
so?
yeah,
Oh my
it's
god.
100%.
Guys, book your appointment. It's happening. So here's the thing. In my opinion, when you do lip injection, when you do it over a long period of time, it is a possibility. It's just there. It's a common sense. By providing all that channels, your filler will be moving to a different area, which will be your white part of your upper lip. So you don't want filler there, because that's what makes you look like a dog. And that's going to happen when you do it over a long period of time. So when it comes to time, your provider has to do an assessment, and if we have to get rid of your old filler, it's the best thing someone can do for you, to get rid of all that migration, to start all over fresh. Therefore, your result will be 10 times better. I guarantee you that. I am starting dissolving more than usual, and I love it.
Yes.
I'm
it's
very
a much,
proud of myself.
Much better result.
Absolutely.
We see filler migration in the lip way too often. I will say the patients that I've done their lips, I haven't seen I haven't seen none migrate, but I don't know if it's just technique. But I will say sometimes people mistake migration for aging. As we age, we're losing our bones, right? So our teeth are receding,
the skull
our
for
bone
me?
is
The skull?
receding. Therefore, this area here is not getting as much support. So sometimes that lip filler looks like it's migrated, but it's just because above it doesn't have the support it used to have.
There you go.
Oh, Jerry.
Hello. This is our friend Jerry. You guys should say hello to Jerry.
So we lose this bone. We lose all bone as we age.
We just lose everything.
You can lift it up more.
As we age, we lose mass, right? So I tell people or patients that pretend dining room table seating for 12 goes to a seating for 8, goes to a seating for 6, but your tablecloth has remained the same size, right? So our bones are shrinking, our muscles are shrinking. So we lose muscle, bone, mass, teeth through here. So what happens sometimes is that filler then sits up on the lip. It looks like migration because we've lost volume here.
And the support, right?
And that support. So sometimes if you've done this, I've done it. This is why I'm speaking about it. I've reversed people like, oh girl, that's migration. It's horrible. Let's fix it. We'll reverse it. They come back and it's not exactly where I want it to be because it wasn't just that being the problem. It's that we've lost that support system. Once we gain that support system back, it actually becomes flush with what we thought was migration. So just food for thought.
Let me ask you this. Do you offer any treatment to help the patient to preserve their bone? Just like Waseem mentioned, as we get older, osteoporosis, menopause, we lose calcium. So this bone gets small and smaller. That's why maybe if you look at your father, if you look at your grandparents, they're like so much shorter than what they used to be.
Right.
So that's a perfect example that how easily we lose bone as we get older. So one of the recent treatments I've been doing, and I learned that from Dr. Shinobe, is by using Sculptra, going very deep to try to spread the biostimulator over the skull, over the
Right.
bone to preserve the bone. So how do you feel about that?
I like that idea.
Yeah.
I kind of feel like Radius does that a little bit too. I use sculpture
No,
as
no,
well.
we do
but
love both.
Yeah, but I think going deep down to periosteum or top of the bone,
It's
and getting
important.
any biostimulation down there, even PRP if you're the right age, I think that just helps rejuvenate it. And looking at PRP, PRF, all these biostimulants, doesn't matter which one. If you look at the NFL or NBA, that's what they're using for joints. That's what dentists use in the gums for the
Absolutely.
bone, which teeth is a bone, to heal quicker. So I do think biostimulants along the periosteum or on top of bone is amazing.
So beside taking care of your skin, make sure you do take care of your bone. Like
Right.
you don't hear that a lot, that hey, I'm here
No.
to do some bone enhancement. But I think it should be something that we can educate our patient and talk about it, because this is the foundation of your house. You want to keep this strong. What did you call his name?
Jerry.
Jerry, guys, moving forward.
So one thing I always want to talk about, I don't know if we have enough time, but maybe another time, is changing your Botox treatment to make other muscles stronger. That's something I could do a whole lecture on, really. But
By
when
all
do
means, go for
do we
it.
do we
Yes,
have the time?
7 minutes.
We'll give you.
That's short, but I'll do it. I
Go
can do
for it. Yeah, you got this.
So let's say we're, like as, providers, we're assessing somebody. So if you're thinking about a muscle, if you paralyze one part of the muscle, the other parts will compensate for that, meaning they may get stronger. So if you have a aged patient that has a weakened mid-brow and you want that brow to get stronger, tell them, hey, look, it might not look as amazing as you normally get your Botox, but let's paralyze the lateral edge of your frontalis, making the frontal of your frontalis a little stronger and get that to raise. Same idea I do in I'm going to use the masseter as another example.
Love
If we
that.
weaken the top, we make the bottom stronger. That's what I do to myself, just letting you know. If we make the top of the masseter weaker, the bottom's going to get stronger and you're going to get more of that golf ball protrusion. For men who have a strong masseter, you're going to make that part stronger because our body's in compensation. So it's going to compensate by doing that. So if you see a patient that would benefit from that type of treatment, you have to inform them this is a journey that we're going to go through together because I want to strengthen your muscle. You're asking them to work out another part of their muscle to accommodate what maybe other injectors have overdone over the years in some areas that they shouldn't have gotten higher doses of neurotoxin that they did, and you're trying to correct that. So we have to weaken some areas and make some areas stronger. So I think thinking outside the box, it's actually, I have a post that I haven't posted yet, but it's on my Instagram about this during one of my Botox, that we talk about making one part of the muscle stronger and letting the other one be weaker to compensate. So this way we can get a desired result. Like masseter is the best example I can give. Frontalis is another good example.
Frontalis are, by the way, it's the your forehead
sorry.
muscle.
I did that wrong.
Waseem teaches a lot, which
Yes.
his knowledge is
Sorry.
unbelievable. No, it's perfect. So little medical terminology here and there, but the muscle of the forehead. So, all right, we do have 5 minutes.
5 minutes.
Da-da-da.
Okay. Does anyone have any pressing questions that we can answer in 4 minutes?
A lot of patients wonder why we can't use certain fillers in other areas, for example, voluma and the lips.
I always make it as easy as possible. I always tell my patient my voluma or radius is my thickest filler, that I would use that for your cheeks, for your jawline, that I need to create a foundation, like if I have to mimic the bone. So that would be just like a clay. And if I need to provide volume for under the eye, I would use a filler that is as thin as a honey mustard, or not honey mustard, maple syrup, sorry. I saw your look, I was like, no. Yeah,
I got excited.
Yeah, you got excited. No,
No, that
maple
was more
syrup
of an
as thin
excitement.
as possible, because under the eye, the skin is very thin, so obviously we don't want to inject something that it's a thick filler. So it really depends on the area, on the tissue, and what we're trying to achieve, I would say.
Yes, the skin quality again is the
It's the key.
big key there. Depending on skin quality, and I tell my patients this, it's not a secret any by means. If the filler's too thick, sometimes I'll add a little bit of saline to make it a little thinner.
Love that. I learned that from him. I'm
Yeah, it's
stealing
very,
that
it's
from
very,
you.
very important because that's how you can get that desired result without it looking overdone. An overdone under eye is not seen
Unattractive.
this way. It's seen laterally from the side.
And it
If
looks like
a
you're
frog.
puffy. Yeah. So not
It's not
attractive.
sexy.
They're asking, what is your favorite filler for lips? I think I have couple. And
I
again,
have 3.
I have 3.
Yeah, 3.
So for my patient who I'm just trying to provide some hydration, if they're in their late 50s or 60s and they're trying to be very conservative, perhaps I would use Juvederm Wobella. I do use Ultra Velour and Kiss.
So someone just asked about R2 or RHA2.
Oh, I haven't gone there. No, do you?
I'd love that for the lip.
Oh, okay.
So that is one of the ones I use for lip, RHA2. I use Kiss and I use Velour.
Velour, yes.
Yes, sure.
All right.
I don't know how to do that.
So here comes the exciting part of the live. We really appreciate everyone. Your love, your support means a lot. So the fun part is we're having trouble loading this video. Are we connected? Just making sure.
It says live video paused on mine. Is it mine that's causing an issue?
We're good here.
We're good.
We're good.
All right. So you guys tell us how we are going to choose the winner of our giveaway.
Because mine here is doing a little circle thing too.
Yeah. Let's exit from it and then go back again.
Alright. So we're gonna start off with Nurse Yelda. If you could pick a number from 1 to 22.
I
One
think
to
mine's frozen. I mean, here it's frozen.
from 1 to 22, let's pick number 21.
21.
Drinking.
Our culture love.
Our culture love. All right, congratulations to you. The giveaway will be our first one, which is, all right, will be 20 units of Botox. So please feel free to, yay, congratulations. Thank you for joining the love. I really appreciate it. Our goal is to really engage with you guys, share all knowledge, and provide the best service for everybody. So please feel free to call the office tomorrow, send a DM, and we would love to book your appointment.
Because I've gotten like 20 people saying it's frozen. It's saying it's paused. Mine says that too. It says live video is paused.
All right, stay tuned with guys. We just
yours
have a
doing
little.
that too?
We are having a little technical difficulty, but we're gonna
I can sing a
solve this.
song. Yep, still frozen.
Just make sure that like the Wi-Fi is connected. Okay, I'm back. Number 21. Okay.
I'm frozen with an ugly face.
And I'm like, yeah, I look super mad for some reason.
No, it looks like you're reading something.
All right, seems like Are we back? I feel like I'm back. Okay, we're all connected.
Yeah.
All right, guys. Sorry for the technical difficulty. This obviously can happen. This weekend I was taking a seminar that in the middle of the seminar the roof would start leaking water, so things can be worse. So welcome back. All right. So who is the next number?
So,
Okay, it
1
says we're back.
from 21.
1 to 21. I will pick number 7.
Number 7, Leo 143.
All right, number 7. What is the first name?
Leo,
Lael.
Leo, L-A-Y-A-L.
All right, Leo.
143.
Again, just feel free to book the office. You can send me a DM to book your appointment. Would love to have you here. Thank you so much for being here, guys. So now let's go ahead and
Oh, do my giveaway?
absolute. Yeah,
Right?
yeah. You're
Yeah.
not taking them home. No.
What?
Yes,
Okay.
sorry.
So,
Alright, so if you could pick a number from 1 to 22.
14.
14. We have Loiren, L-A-U-R-E-N, L-U-Y-R-E-N. For lip filler.
Okay. Lauren.
Lauren.
All right.
Who-
Lauren.
Yeah, if you're there, just again feel free to DM Waseem or contact his practice and book your appointment.
And we have one more.
Okay,
One
and then
more.
one more would be for the 20 units of Botox. Okay, la la la, 20 of Botox.
21.
You already picked 21, and what was your other number?
I also picked 7.
Okay.
7.
2.
All right, 20 units of Botox. So
Danielle Schaffer.
Danielle Schaffer.
All right.
Awesome.
Yeah, Lauren. All right, that's amazing.
Yay, they're excited. No, thank you guys. This is good. We're gonna continue with this. I appreciate everybody.
Yes.
Stay tuned. Keep us posted for the future if you have any question. Thank you for joining us.